80 and 100. That's where most of our hemolytic anemia would be. So we put this one on the side just in case you find it. What you're more likely to find is direct bilirubinemia. And if that's the case, we saw then number 2, check enzymes. And in checking enzymes, you're going to have 2 big groups. You have the one that have increased transaminases mainly versus the ones that are going to have increased alkaline phosphatase gamma GT. If it's increased transaminases, then it's hepatic, we said. If it's increased alkaline phosphatase, it's cholestatic. So then if you work on the hepatic story, then we saw number 3, whoops, check the levels. Because as you check the levels, you're going to see 2 broad groups come about, right? They're less than 500 units per liter, so just like the guy in our case, and quite relevantly, AST is greater than ALT, just about double, then you can say it's alcohol. Whereas when it's much higher than 500 units per liter, often in the thousands, and generally ALT is greater or equal to AST, but not that big discrepancy between AST and ALT, then it's not alcohol. So there, your next step is going to be to check serology. And as you check for serology, you're going to be able to split this into 2 groups, viral or not. Is that okay? So when it's viral hepatitis, well, does it matter the type of virus, or do they all show the same pathology, viral hepatitis, when it comes to looking at the tissue? Nearly, actually, they all show the same. Basically, based on the histology, you would not be able to say which one it is. Because hepatitis viruses are cytopathic. They cause hepatocyte death, so you'll find those famous Councilman bodies. So apoptotic hepatocytes. And because they're viruses, you're gonna tend to find lymphocytes in the portal tracts. So in zone 1, and generally some hepatocyte regeneration. Now, if it's chronic, remember that you see limiting plate necrosis. So just on the surrounding of the hepatic lobule, right? So that's why we need to have the serology to make the difference, because histology-wise, they all look the same. Is that okay, Niley? Yeah? So let me blow this up a little bit. That's actually simply to see if you want the damage inside the actual hepatocyte. Sharon, that's to see the surface antigen, if you want, being made. That's all. And ground glass appearance then is not unique or pathognomonic of hepatitis B. It just shows you that there's a virus that's expressing some surface proteins. Is that okay, Sharon? So you need the serology, and you really have three big serology to think of. For example, you see positive IgM for hepatitis A virus. Then, of course, you know hepatitis A is a picornavirus. Picornaviridae, they're positive single-stranded RNA type of virus, but they are naked. So if they're naked, then you know, like Hep E viridae, it's going to be fecal-oral transmission. And never gives you chronic. It's always an acute hepatitis that you're going to have in that patient, and there's no treatment. The prophylaxis is sanitation, basically. For hepatitis E, it's really an issue primarily in which patient for Hep E? That's right, in pregnancy. That would be an issue. So that would be one type of serology where we don't do too much. Now, your other serology could very much be positive for anti-HCV antibodies, and possibly otherwise you have HCV RNA in the acute infection that you could measure with PCR type of technology. Well, then you know you would have a flavivirus there, hepatitis B, and we discussed above when we saw its treatment earlier on in detail, and to the point of creating some distress in our friend Zaire. But we know at least all the treatment, and all we are left with putting is that it's linear, it's non-segmented, and of course, unlike hepatitis A or E, it is enveloped. So if it's enveloped, it's bloodborne pathogen. Now, importance of hepatitis E, more than 80% become chronic carrier. And if they become chronic carrier, then they can develop cirrhosis, and they also have oncogenicity with potential for hepatocellular carcinoma. So I'm going to say see above for treatment, and the drugs I was plaguing you with, they have the advantage over interferon and ribavirin that they have cured people with hepatitis C. It's just they're very expensive to use, obviously, but they manage to eradicate hepatitis C. Now, of course, the more exciting one as a serology is for hepatitis B type of serology. And for hepatitis B, we already explained that this was a double-stranded DNA circular type of virus, and it was enveloped. And quite importantly, see above again for the treatment, as we talked about them in our question. It is less likely, this one, to have carrier. So generally, less than 10 to 20% become chronic carrier. And the serology is going to help us figure this out very well. So two possibilities of serologies here: acute versus chronic. In the acute hepatitis B, then you should be able to find some of the viral protein, so the surface antigen we're going to find, right? We're going to find the core antigen, and then another core antigen, which is HBe antigen. And yes, Sam, we're definitely going to put this in as a note right below, promise. And with HBe antigen, that would indicate what? Are you contagious or not when you find the HBe antigen? Infectivity, absolutely. Right there, you'd be contagious. And what you might also be able to measure, if you were measuring some antibodies, it would be what type of antibodies in the acute hepatitis B? Yeah, but against the core, potentially also against surface antigen and E antigen, but there would be IgMs, not IgGs. Is that okay for the acute hepatitis? Yeah? So look, contrast in chronic hepatitis B. In chronic hepatitis B, what you'll still see is positive HBs antigen. But now they've been positive for more than 6 months. Wow, that's a lot. And at the same time, this time you have IgGs instead of IgMs, and it'll be against HBc antigen and HBe antigen, but you don't find them against the surface antigen. So, by the way, as a note here, if you only see IgGs against HBs antigen, then that's a serology that is that of what? That's right, a vaccinated patient. All right,